All right. So my name is Mathias Sweet. I'm the Ryan White Program Director for Neighborhood Medical Center. This is.
I'm Joseph Ward. I'm the health educator, outreach specialist for our Ryan White program, and we're going to have a good conversation about sex, safe sex, STDs, and giving y'all the information that you all need to know to keep yourselves safe, but also information you need to know as healthcare professionals on using this information, practicing what you preach, but also the best way to relay information to your patients. You all gonna have patients from all sectors of life. Mm-hmm. So you gotta put yourself in a position, for one, to continuously learn about yourself as an individual and as a professional, but on the other hand, making sure you continuously learning about the people that you are serving. We serve a wide range of people, and it gets real interesting. Very, very, very interesting, especially like when we're out in certain places in the community, because there are no rules when we're out except the rules that we set for ourselves or the people who are with us to keep us safe. But we can't go to Houghton Street and do an outreach and tell the people that, hey, put that blunt out, or hey, you can't drink that, or hey, y'all stop kissing in the mouth. We can't tell nobody what to do. But all we can do is make sure that we govern ourselves, but learn the people that we're serving. If we learn the culture of the people, we learn how to behave around these people, we learn how they will allow us to help them, then we could be successful. All right.
Okay.
Now that y'all done started talking about sex, we can start talking about sex. Because like you say, we do that to get the group lightened up, especially younger groups, but we like to get the energy flowing for what we're talking about. We're talking about sex, but we're talking about safe sex. Talking about making sure that we can convey messages properly to the people that we're serving. Think about your patient as your favorite person. Every time you have a patient, that's the person you love the most in the world. And you need to go above and beyond for that person. Because think about this, and especially from our point of view, we do HIV/AIDS testing, trainings, classes like this. If somebody comes into us and we sitting down in a counseling session with them, whether it's strictly HIV or it's HIV and STDs, and we give them a bad experience, if that person is positive and we give them a bad experience, we may deter them from seeking further care. And that's not what we want. We want people to be in care. We have one of the mottos that they're using is U equals U. Have any of you ever heard of that before? What does U equals U mean? Undetectable equals untransmittable. Who doesn't know what that means?
It's okay if you don't know.
Okay. So undetectable means if it's undetectable, untransmittable. Basically, if I don't have enough HIV cells in my body, I can't transmit HIV to another person. But we're talking about people who are what they call virally suppressed. And virally suppressed means I am taking my medicines on a regular basis. Because I'm taking my medicines on a regular basis, I'm not producing enough copies of HIV in my body to transmit HIV to another person. But that's still all dependent upon that person's behavior of continuing to take their medicine on a daily basis. Now, that's for people who are HIV positive. We're also dealing with the majority of the population we're going to be dealing with, they're not HIV positive. They may have STDs, but then the majority of the people you're dealing with, they're negative. So we want to be able to keep these people negative. So that's why we go into the prevention information. For one, start here. If they're not having sex, if you don't have sex, cool. You don't have to have sex. You don't have to pressure nobody to have, don't let anybody pressure you into having sex or anything that you don't want to do. We do preach consent, and we preach making sure that people are comfortable within the settings that they are in. Same thing with you and your patients that you may be dealing with. You may have a patient that come in that they don't really want to have sex, but the people around them in their circles. Think about when you were in high school. Think about, you are in college now. Be honest with yourself about the sexual environments that people live in. Mm-hmm. We live in Tallahassee.
Mm-hmm. There you go, Tallahassee.
I was just about to say it. She took it right out of my mouth. They call this city Tallahassee and Tallahassee for a reason. We earned our name. So me being the person I am, when I was in college, My name was Tally Ho Joe. So you fill in the blanks, right? But it's the mentality that we have. So I'm just being honest with myself. We do HIV testing on a regular basis. We test on this campus, we test on FAMU campus. Even though we hear people saying they don't have sex, we look at the numbers. We know people are having sex. We look at the STD numbers, we look at the HIV numbers, and we look at self-reporting surveys, all these things. We know the majority of our city is having sex. We know we have populations of 13 to 24. 13 to 24, not just in Tallahassee or Florida, but nationally have the highest rates of STDs of anyone in the country. We know chlamydia is the country's #1 STD. But guess what's Tallahassee's #1 STD? Young chlamydia. Chlamydia is the greatest rapper of all time, and it's not giving up his title. Now, we have a little joke, but we see it all the time. Chlamydia is high in college population, so we sometimes say if you're a college student in Tallahassee and you don't get chlamydia, you probably didn't try hard enough. Now, right, it's just that easy to get. Now, of course, we're joking about that, but we don't want anybody to get it, but we want people to get in that mindset that this is the easiest STD, or one of the easiest to contract. Chlamydia, gonorrhea, syphilis, those are the top three STDs in this city. HIV is here. I think less than 1% of the population may have HIV. We could be, at our height, we could be around 300,000 in our population, but we can hover around 200, maybe 250,000, especially at the height of school when everybody's in. But last I checked, I'm not saying this is the current number, last I checked, we had around 1,500 people in Tallahassee who were HIV positive. Now, let's look at another dynamic. 32304. 32304 is the poorest area code in the state of Florida. That's the area code that we're in right now. In this area code, we have an abundance of college students, a lot of low-income people, and a growing homeless population. So a lot of people who are low-income, who may be HIV positive, all live in the same area, and they live in the area where you live as well. And we also know in this city, another thing that happens is prostitution is big in this city, whether it's people walking down the street, whether it's people on North Monroe selling their bodies out at hotels on North Monroe, whether it's the person sitting next to you in class, add in the OnlyFans element. We got all these things that's going on. So sex is happening. We would be fighting a losing battle telling people to not have sex, even though that is a part of our message. If you're not having sex, you don't want to have sex, you're not ready, don't do it. But if you are having sex, you need to protect yourself, and protect yourself at all times. It's like a boxing match. It's your job to protect yourself. It's not my job or anybody else's job. It's not your partner's job to protect yourself. Yeah, you could be mad at me because I gave you 3 STDs, but be mad at yourself first because 1, you didn't know my status, and 2, we didn't protect ourselves. When you meet somebody new, what's the first thing you should do before you have sex? Get tested. Why should you get tested? To know that person's status. Let's all be honest with ourselves. We know after a while in relationships, condoms come off, especially if the sex is good. That condom coming off. That too.
Right.
That too. Sometimes it don't ever go on.
Right.
Right?
But you also got to remember as well to have conversations. It's a lot of different things that people don't know about their partners and things like that till you find out later during the sexual act or afterwards. So a simple conversation could have been had that could have told you something. We see every day, we had a gentleman come into the office. He wanted to get a test for HIV only because he left that morning to go to work, picked up his local prostitute, had sex with the prostitute.
Oh, yeah.
Oh.
Him.
The prostitute wasn't a female, it was a male. The male took the condom off and ejaculated inside of him. And so he came into us because now he got to figure out how he going to tell his wife when he goes back home, they got to use a condom again. Or we can't have sex for 30 days until my test results come back and I'm taking PEP, which is post-exposure prophylaxis, which is the medication we give you to prevent you from getting HIV. Also, we call it our Plan B pill. So it's like Plan B for birth control. We got Plan B for HIV, which is PEP, post-exposure prophylaxis. But we can also put you on something if you're out there having multiple sex partners doing things. We can put you on PrEP, pre-exposure prophylaxis, which is a medication you take once a day that prevents you from getting HIV. So you don't have to worry about that. But every day around 4:30, we get somebody to call and say,
Especially Fridays.
The person just had sex with me. We just had sex and they told me they were HIV positive after they nutted inside of me. Every Friday, like clockwork. And we have to turn around and get this medication. We get it for you for free, even if you have insurance. But it's the time-consuming part is it has to be taken within 72 hours in order for it to work.
And he said Friday at 4:30, and most places shut down at 5. So we're talking about a process that may take 24 hours, depending if you have insurance or not. Because if you have insurance, we have to get a prior authorization, which usually takes a 24-hour period. So now we're going into Saturday. Now, hopefully we can get in touch with the provider on Saturday, because we can still do what we need to do on our end. We can call the CVS and we can do as much as we can, but if we can't get in touch with a provider to write the prescription on a Saturday, then we have issues. Mm-hmm. And that's why we preach using condoms so much. Knowing people's status, using condoms. You have to do it. This is a picture of gonorrhea. This is what gonorrhea looks like in the body or when it's discharging from the penis. Penises do not discharge on the regular. If anybody pull the penis out and discharge, that doesn't mean he's hot and ready. Right? And I say that because I think about a lot of the things that I've heard. Mm-hmm. I think about myself when I was in high school, things that people used to tell us. I grew up, I'm the porn generation. We like the first generation gamers. We the VHS porn watchers and the scrambled porn watchers. And then when we found DVDs, it blew our mind. Mm-hmm. But then think about it, you got a whole generation who can pull out their phones and you can go to Twitter. Everybody knows Twitter.
Right.
Twitter.
We ain't had that, Joe. All we had was what? The little line, we had the box, we had to move the antenna.
Yeah, the way
and then you had to look through the little lines and try to make out the pictures. That's what we had. We old.
But we have people who are raised sexually, who are, I guess you could say, given information sexually and the information is not necessarily correct. It's for entertainment purposes. So you see an image in real life that you saw in these realms in porn for a while. You're like, oh, well, this person got to be hot and ready for me. Well, no, that's actually discharge. Mm-hmm. That means the body is trying to dispel an STD. And so that's why I put it like that, because I want you to get the visuals, but then put the pieces of it together. And so when you are thinking about giving this information to your patients, what's the best way you can teach your patients? What's the best way you can give them visuals and things that they can take home? Now, I use extremes to get you to think about it, but I want you to also remember that there's also gray area in this, and there will always be nuance. This is another picture, closer up of the penis discharging. Just remember, penises do not discharge, or regularly they don't. This is a person with the gonorrhea discharge in their eye. So you can use your imagination on how the person got gonorrhea in their eye. But the truth is, you can contract an STD. Once you contract an STD, depending on where you get it, it can affect you from the top of your head to the bottom of your feet, front, back, side to side, inside and out. There's no part of the body that's safe. The long, well, this one ejaculated. Either somebody ejaculated in his eye, either he put his face in the wrong place, or he might have wiped his eye and then washed his hands or things like that.
Or we actually had a case in Leon County. Huh?
I was saying that too.
The little girl was giving the older guy head. He ejaculated. She had on her mama eyelashes. So she went home and took the eyelashes off and put them back. Mama put them on. Baby brother touched mama in the eye like this in the face, and all them got gonorrhea
like at least 4 or 5 people
in the face. So now you got to figure out how I've got to call DCF, do all this, because how does an infant get gonorrhea and chlamydia? How do they get all this stuff? And then everybody's trying to figure out what's going on.
Right. Well, we eventually found out.
Eventually she told. She got to tell, but you're going to look at the parents and say, so, Dad, are you molesting the children? What's going on? All this other stuff. So it's a lot of things that could go happen, but people don't want to tell the truth.
Also, and within that, if your wife or your spouse just comes home or wakes up with gonorrhea in their eye, you're going to think your spouse was cheating. So that's a lot of issues that's caused in the house. But that's why I'm adamant about parents. When you become parents, if you're already parents, children, talk to your children about sex. Do not send your children out into the world and you haven't given them information about safe sex. I like to put it like this. If a parent would not buy their child a car, teach the child nothing about the car, and say, hey, get on I-10 and just drive. Nobody will do that. The parent will be thinking about the safety of the child. I need to teach you how to drive so you can be safe when you're out there driving by yourself. Well, I need to teach you about safe sex so you'll be safe when you're out in the world having sex. And so that's one thing that we've been preaching for a while, to make sure that at least the children, when they come to college, they have more safe sex information, more sexual health information. The same thing going out with you guys as health professionals. When you get a chance to give information to people, make sure you give them that information, because you never know, the information you may be giving them, it may be something that they're hearing for the first time. I still have never had the sex talk in my house.
Me neither. And I talk about this all the time.
And we old.
And I got a 19-year-old. And she knows everything. She gets condoms. She knows she's been through this class. She's seen these pictures. She knows if anything goes on. We talk about everything. I know when her period come on. I know when everything. I know everything about her boyfriend when she has a boyfriend. I know we talk about things because it's that open line of communication. Because if something goes wrong, I need you to come to me because I can fix it.
Support.
So the whole issue is, if you let this go and don't treat it, it can cause a lot more things in your body.
Right.
It can cause you to be sterile. It can cause you to have pelvic inflammatory disease, where you have to have emergency hysterectomy. So your chances of having children could be none. But if you come and get tested regularly and talk and have these conversations with your kids will be more open to come to you about it.
Yep.
I always tell people, I ain't never gonna say what my child ain't gonna do. Because the minute you say they ain't gonna do it, they gonna do it. I'd rather tell me, hey, you having sex? It's okay. It's cool. I understand. I just want you to be safe with it. Because at the end of the day, I don't need to raise no babies, and I don't need nothing else to happen to you. Because one of my good friends, when we was in high school so long ago, she fell over in the middle of the hallway. Didn't know what was going on, nothing. She had chlamydia and it ate all her eggs, and she had to have a hysterectomy because it got so bad because she didn't. We were 17. So just imagine, now you can never have kids. You can never have anything, all because it gets in there, it can get in your body and become septic. Most of these STDs are bacteria. They will kill you faster than HIV. I want y'all to understand that. If you think you got an STD, go get a clinic to the checkup. At our clinic, we test in every orifice, whether you got it or not. We swab your mouth, your penis, your vagina, and your rectum.
Pop question. How often should you get tested? If you were regularly having sex, how often should you get tested? Every 3 months? Mm-hmm. Why should you get tested every 3 months? Yep, so especially HIV. So it takes HIV antibodies about three months to develop in your body. But same thing with STDs. If you look at the incubation period for STDs, some of them can be 2 to 3 weeks, some of them can be 1 to 3 months. So around that time frame, every 3 months if you're sexually active, every new partner, if you're both actually practicing monogamy, you can do every 6 months to 12 months. But if you think something is wrong, stop having unprotected sex, wrap it up, make sure you're constantly getting tested. If you, like he was going back to the scenario when the guy was cheating on his wife with the other guy. If your partner comes to you, you've not been using condoms, and your partner saying, hey, we need to use condoms. Should you use them? You say yes. Why should you use them? They're asking you for a reason. Hey, let's use condoms because I'm not trying to give you what I have.
But then that prompts you to ask another question. What's going on? What it is? Let's be open, and that's the point we tell all the kids, even when we talk to young kids. If you can't talk about it, you shouldn't be having sex. So if y'all can't have that open conversation with the person you're having sex with, there's no reason for you to be having sex because sex is an adult activity.
Yep.
So if you can't talk about it, you got to deal with the consequences that come through.
Yep. So this is another way that gonorrhea can affect the penis. This is the epididymis is the gland that sits behind the testicles that house and produce the sperms. The epididymis is disturbed, and so now the testicular sac is swollen and it's tender, and it's excruciating for this person to actually walk. So you got to be mindful about the people that you're dealing with and how the different STDs can affect people differently. My body is different from your body. Your level of health is different from my level of health. So can't just look at everybody as the same. Also, we want to get people to stop getting themselves tested through their partner. So if my partner don't have it, then I don't have it. That's not necessarily true. This is disseminated gonococcal infection. Basically, the gonorrhea is in the person's stream, the bloodstream, siphoning through their bloodstream. The person has had gonorrhea for a while, and now you're seeing the black lesions that are starting to show up around the joint areas. So when it gets to the disseminated part, no matter where on the body, it's going to affect the joint areas. So everything that bend, move, twist, and turn, you start to see the lesions show up. Leave it there for a while, then severe rheumatoid and arthritis, rheumatism and arthritis, all that could happen. So you could catch an STD that could begin as discharge, and it could over time persist to something that maybe really damage your system, because these bacteria are trying to stay alive, and they will damage your body trying to stay alive. This is gonorrhea inside of the vagina. I always tell people, well, we don't walk around with like the pap smear equipment that we can look inside vaginas, so it's not like we can actually see what's going on in there. So you're either going to protect yourself, you're going to take a person's word for it. You can take their word for it if you want to, but if this is going on, and like the bottom bullet point says, if they're asymptomatic, they have no physical signs or symptoms, so they don't know they have it. They say they don't have it, they feel good. You don't think they have it, and you have sex with this person, now you have gonorrhea. So you got to be careful. Get tested, use protection. This is an example of a vagina discharging. When I'm in a room full of young boys, I repeat my words like 10 times. This does not mean that she's hot and ready. You got to be specific. This does not mean
And what you tell them, Joe?
that she's ready. You can deal with it if you want to, but you are going directly into an STD.
I'm talking about red.
Oh yeah.
What you tell them about the red?
So over years, I've started saying this, especially when it comes to sex, and it's more so for the woman, but it can be for both men and women. Red means stop, and what I mean by that is, what color is a healthy vagina on the inside? Pink, right. The back of your throat, when it's healthy, what color is it? The inside of the anus, when it's healthy, what color is it? The inside of the penis, when it's healthy, what color is it? If any of those areas are bright red, that means infection is present. That's just a cheat code to see that, hold up, something is wrong here. If you have to think twice about anything when it comes to sex, if you got to think twice about it, don't do it. If you feel like it's wrong,
Don't smell right.
if you feel like it's bad, if you think it's bad, if it don't look right, it don't smell right, anything, put your clothes on and go home. If you're home, send them home. Do what you need to do to keep yourself safe. That don't mean you got to go and just trying to degrade people or anything, but you need to do what you need to do to keep yourself safe. Another example, she has gonorrhea in the back of her throat. We had an intern who had a roommate, and it was chlamydia, but the roommate contracted chlamydia. She had it in her vagina and her throat, and she refused treatment because she was going to continue sleeping with that guy anyway, and he was going to keep reinfecting her anyway, so why get treatment?
Mm-hmm.
But that's the mentality of some people. So imagine the next person that deals with her. Or imagine if you end up dealing with somebody that dealt with her, or somebody that dealt with her, somebody that dealt with her, because it can go down the line. Mm-hmm. So you got to think about that. That's why you want to ask. You want to ask questions. You want to have good conversations. You want to get tested. You want to use protections. Dental dams. Any of you know what dental dams are? Y'all ever seen a dental dam? Who doesn't know what a dental dam is? All right. I'm gonna be dating myself. Let me try this. I'm gonna ask this question. How many of you have seen the movie Booty Call? Okay, y'all don't watch BET.
We old.
All right. All right. So Booty Call was, you know how Baby Boy come on BET like every day now? Booty Call was like the first movie like that, but it was a movie that came out in the early 2000s. Basically, I referenced this movie because they had a scene in the movie where they were practicing safe sex for oral sex. So when a dental dam is basically what somebody would use to perform safe oral sex on a woman. So you could put, it's a flavored latex covering that will cover the vagina or the anus. It's the equivalent to the flavored condom. So if somebody wants to give oral sex to a man and don't want to contract an STD in their mouth, they will put a flavored condom on him. If they want to perform on a woman, they will put the dental dam on the woman's anus or vagina and perform the act. So the dental dam is that latex sheet that's going to keep you safe. The movie Booty Call, the reason why I referenced that is, in that movie they were trying to show us what safe sex was, but they put a comedic spin on it. So in the late 90s, early 2000s, people were using the plastic wrap, the plastic wrap that you wrap your food, the saran wrap. They were using that as a form of dental dam. But the problem with that is we found it was porous, so it didn't necessarily keep you safe from STDs. Even though you're in the right direction, you're just not all the way in the ballpark. But in that movie, they like cocooned themselves up and wrapped themselves up and almost killed themselves. But it was like one of the first times that we saw in a movie that people were really trying to promote safe sex in that manner, but safe oral sex, especially somebody going down on a woman. Because usually when you think about, especially when I was growing up and when he was growing up, when we talked about safe oral sex, it was mainly using the flavored condoms on the man. But safe oral sex goes both ways. Now, we also live in the real world, and we know how people feel about condoms and oral sex. Nobody wants to use condoms when receiving or giving oral sex. We know that. We know that. But now you got to make a decision. What's more important? You got to make a decision, because this is gonorrhea in the back of somebody's throat. Do you know that person's status? Are you going to use the safe sex materials? And if you don't use the safe sex materials, what will the consequences be? Will the consequences be that you contract an STD? So you got to make decisions, but you want to make sure you make the best decision for yourself.
And also, when you go to the doctor, we want you to tell the truth. The doctor is not here to degrade you or talk about you or look down on you. Tell us how you're having sex so we can treat you. Because some places won't swab your throat. You might think it's just a sore throat or something else. It could be a STD because you're having oral sex. You got to be able to tell, because some antibiotics don't work on every bacteria infection. So we need to know what we're testing for and looking for. So it might come up that it's negative for strep, it's negative for this, but you're not telling the provider, oh, well, I had sex with somebody else and you use a condom, so your vagina and anus is okay because you used the condom, but you didn't use the condom when you had oral sex. Or we have a lot of girls who are on campus and they don't have vaginal sex or anal sex, they just have oral sex and say they don't want to be called a quitter, so they just swallow, but they don't say nothing. So if you're a virgin and you're just having oral sex, when I test your vagina and rectum, it's going to be negative. So, but your throat is the issue.
Yeah, so context. That's all your face. Context, like we actually did, we met a young lady on this campus. We were doing HIV testing. It was pre-pandemic, we were doing testing, and we were talking about safe sex. And in her mind, I don't need to use a condom when I give safe sex, and I have to swallow, because if I don't, none of the men will like me.
Because I'll be called a quitter. I was like, I want to be called a quitter every day.
Yeah.
It's okay.
So we had to take off our work hat and put on our big brother hat and get on her. And like, no, you don't just go around just doing that just because somebody claiming that they like you. Like, you save that for the person that you with. So it's everybody don't have the same education about sex. Everybody don't have the same self-esteem level. And sometimes an outcome won't be favorable. So you got to be careful about that. This is another example of disseminated gonococcal infection. Once again, the gonorrhea is in the person's system. They didn't get treated enough time, and now it's showing up around the joint areas. So chlamydia is similar to gonorrhea. You can see the incubation period could be 2 to 3 weeks. It can also be asymptomatic. Chlamydia is often called the silent disease, and it's mostly called the silent disease more so in women than men, because there's a good number of people who have chlamydia and don't know they have it because no signs or symptoms. This is an example of a stillborn baby. The mother had chlamydia, but the mother didn't get treatment in enough time, and the baby became affected, and the baby died in the womb. I actually tested a couple, like maybe 8 to 10 years ago. I tested a couple. The young lady was 8.5 months pregnant, and she had just got cured of chlamydia, but she didn't cheat, and the dude didn't cheat. So chlamydia just showed up out of nowhere. And so I'm looking at them like, you guys are about to be parents in a month and a half, and you can't be honest about each other, about who was sleeping around. That's not safe for that baby. That's not safe for the health of that baby. Got to be careful who you're having sex with.
Did they end up saying it?
They never said it because nobody wanted to admit what they was doing.
So they just got treated and kept it.
Mm-hmm.
The baby gonna be all right though, right?
Hopefully.
But they test the baby when they have, when you come positive for STDs and stuff, they test the baby when the baby comes out.
Right.
So they do, like, especially like you can have, if you're HIV positive, you can have a normal, healthy baby. Things have changed over the years with medication and stuff like that. So when the baby comes out, the baby will be tested the first day, and then again in a month, and then again in 3 months, and then again they'll test them up like that for a year.
Yeah.
But it is possible for you to have a baby if you do become HIV positive and the baby become negative.
And so specific for STDs, so let's say like the example I'm giving about chlamydia, so that young lady, it will be discouraged of her having a vaginal birth, so she'd be more encouraged to have C-section because they want to ensure that the baby doesn't go through the vaginal canal and may be subject to chlamydia. With HIV, like he was saying, you can still have a vaginal birth, but the main thing with a baby that's born to a woman who's positive is to make sure that the baby isn't born HIV positive. So the first 6 weeks, the baby has the mother's antibodies in the system. The baby has to take a regimen of medicine. I think maybe every 2 to 3 hours, the baby has to take a specific type of medicine. The mother has to continue taking her medicine. She can't breastfeed, even though I've heard a few people say that some doctors give the patients the go-ahead if they're HIV positive to breastfeed, but for the most part, they're not going to breastfeed. And if the baby's getting the medicine, the mother's not breastfeeding, after that 6-week period, they'll test the baby again if the baby has once the baby has his own antibodies, and that'll give a great read if the baby contracted HIV or not. Chances are the baby won't contract HIV, especially if everybody do what they're supposed to do, stay on their regimens, the mother's taking her medicine, not breastfeeding, the baby is getting his medicine, the baby should be okay. So, testing the treatment for gonorrhea, chlamydia. Gonorrhea, chlamydia is easily detectable by a lab test, easily cured with antibiotics, but any damage done to the body will not be repaired. So that means if these STDs persist in the body, they could cause physical damage. So syphilis.
That's my favorite.
I hate syphilis, I ain't gonna lie. If I was a rapper, they'd be my op right here. So this is a physical example of what the syphilis look like. Now, this is the easy stage of syphilis. Syphilis has 3 stages. This is the painless, easy stage. It just
how
don't
he
look
said
good.
painless. The sore doesn't hurt, so you might not even know about it. Especially girls, so if the man is uncut, pull that skin back, look at it. Look at it. Don't just put your mouth on it, because once you touch it, you own it.
Examine everything. Go back to, I'll show you mine if you show me yours. You need to, yeah, you can make it a game, you can make it sexy, do what you need to do, but make sure you are taking the precautions that you need to make to understand what you're getting into. But this is an example, they pulled his skin back, but an example of somebody having syphilis on the penis. If this person is uncircumcised, if the foreskin is covering that, and you don't look, or the lights are off, and you just put that in your mouth,
and you see it's fluid coming out. So the main thing is, like I tell people, this is how you get an STD sometimes when you don't touch anything or you're not having sex. But if he goes to the bathroom and touches his penis and it's on there and doesn't wash his hand, he flushed that toilet, you touch that toilet. You touch the doorknob, it's on the doorknob. So you got to understand the bacteria lives on different things. So it's very important that you make sure that even though you don't, it should follow through and make sure you're precautious with what you touch.
Right.
Because once you touch it, you own it. It's yours.
This is an example of a syphilis chancre sore on the vagina. Now,
it's a lot of things wrong.
Is that warts in the sore?
No, that's her and the.
So that part is normal.
Yes.
Okay.
Yes.
Joe, sore to shore. Oh shoot, sorry, I touched something.
No,
Did
you
you mess
good.
up?
This is
okay.
the syphilis sore right here. This.
So what's that?
That's just like how her skin looks.
Is that like HPV or something?
Well, syphilis is known
Whatever
as
three
the great
letters you want to
imitator.
get, I don't know what it. That's just how
So,
she's built. We
right.
just say it like that.
It's
But-
not saying that she has nothing, but also we want you to know syphilis is a great imitator. So syphilis can show up as anything.
Right.
It could take it and mangle it up, and you think it's something different, like maybe like herpes or something else, but it's really syphilis.
Right.
And this right here is where a lot of guys try to figure out. I used a condom. How did I get syphilis?
Well, let's think about it. That's why we need to be a lot more realistic when we talk about safe sex and using condoms. If you're teaching somebody to put a condom on, any man in here who's willing to talk, any man in here, anybody taught you how to put on a condom? Yeah. What did they tell you when putting on the condom?
You like unwrap the thing and you like roll it down.
Okay. Now,
I had to raise
now, when you're taught that, are you taught that you're protecting only your penis or all of your body?
I think that's only the penis, right?
Right.
Because if you have like an open sore or anything and that fluid get into that, then that can
Right. So look at the location of the syphilis sore and to think about what we're talking about, because we are taught that STDs only exist inside the vagina. We're not taught that STDs can exist anywhere on the body. So we got to change the way that we're giving this information, especially future healthcare professionals moving forward. Don't just teach them about STDs just on the penis or inside the vagina. Think about the total body, because
Joe,
we can.
you heard his question?
Go ahead.
He said, how do you protect from this?
How will we protect against that if a condom won't be as effective?
Oh, you don't have sex. You either don't have sex. You could probably use a female condom would cover a larger surface area, or
When you tell they gotta go.
oh yeah,
Yeah.
oh yeah.
Yeah.
For me, yes. For me, yes.
some people-
if you're asking me,
So
we
you actually like examine it? Or
Yeah.
yes,
you just
yes. You examine it. You examine it.
You
It's
gotta
just
look
like
at it.
same both ways. Hey, you got to lift the penis up, you lift the balls, lift everything up, look at everything, examine everything, know what you're getting into. Yeah, I mean, put it to you like this: if you all, if they're in the moment and she don't even have to really tell him that that's what she's doing, just grab it.
Just grab it. Pull it back. Look,
Yeah.
like, I'm finna go in. I'm
'Cause
finna go to
you
work.
can-
I just,
'Cause you don't-
look at it and say, okay.
Because you can
gotta look at it first.
you can be sexy about it. You can stay in the moment.
And then like for a guy going down on the girl, it's down there. You better look while you going down. Like, I mean,
But also
and scan.
but look, well, hopefully you all are having conversations before you have sex. I know that's not 100%. I know times have changed. We realize we getting old, because back in my day, you actually had to have a conversation before you had sex.
See, we didn't have Facebook, Instagram, Twitter, Snapchat,
You had to walk up to
BGC,
somebody
A
and
for
talk
A,
to 'em.
Plenty of Fish, all these little apps. We didn't have that. In order for us to meet somebody, we had to go to the library, to the game, to the club, and we actually had to have a conversation in order to get a number.
So, but still now, conversations still need to be had to this day. Have a conversation before y'all have sex. What are you talking about that leads up to you having sex?
Mm-hmm.
You need to say, hey, well, I want to have sex with you. You want to have sex with me? Well, let's talk about how we're going to have sex.
Mm-hmm.
Let's talk about your sexual history. When the last time you was tested? Let me see your test results.
Always
All
get the
those
black and
things.
white. Don't trust nobody's word for word.
Right.
You don't, what they say in nursing school, if it ain't in black and white, it ain't happen. Your test results ain't in black and white, it didn't happen.
Right. So this is 2 canker sores and the person is uncircumcised. So just another example of why you have to examine everything. This is another example of the syphilis sore here on the outer portion of the vagina and the vaginas.
Mm-hmm.
You know,
Yeah.
I just keep it moving. That's just me. So this is, for me, we went to college at FAMU. So when we were in school and we would hang out on the set, people were mean.
Mm-hmm.
So there were a few people on campus who liked to point out your flaws. And the way they did it was they would carry around a referee whistle and the football flag, like the referee, the yellow flag. And whatever they found egregious about you, they will walk up to you, blow the whistle, and throw the flag on you. So bringing full attention to what's going on. So the way I think, my mindset was, well, one thing I would never want to do is contract an STD specifically in my face and have to walk through FAMU campus and somebody throw a flag on me. Because that's just the way my mind thinks. I think in extremes. So when it comes to safety, so when I saw this picture, I was like, oh, okay, well, this is a great example of you can contract an STD anywhere. Let's talk about stigma. And let's be real about stigma. How many of you will have sex with somebody and you know that person has an STD? So let's say the person says, I had an STD 2 years ago. Would you still have sex with them? So we all understand, so everybody understands stigma. So remember, that stigma affects you too. So that same stigma that we play into, that we are a part of, that we participate in, is going to affect us too. So if you're going to have stigma against somebody, they're going to have stigma against you too. Now, of course, we're working to break the stigma, but if we're being honest with ourselves, once again, we ask the question everywhere we go. How many of you would normally have sex with somebody with an STD? Nobody ever raises their hand. So that means we all understand stigma. So how are you going to A, help to combat stigma, but B, make sure that you put yourself in the best position to keep yourself safe? And the third one, as healthcare professionals, how are you going to aid in making sure that other people have the information they need to keep themselves safe? Thinking about that. We got to break the stigma some way, but we also have to keep ourselves safe. This guy has the syphilis sore in the middle of his tongue. You can use your imagination on how he got it. But once again, you can contract these things anywhere. And this is, remember, this is the easy part of syphilis. This is just the first stage. It's the easy stage. If you don't get this cured, it get worse.
Hold on, Joe, go back. So y'all know y'all go in the club, right? And them guys come up to you and whisper in your ear and lick on your neck or something. Remember, this touch you own it. Or
Well, they might not do that no more though.
Oh, you know, back in the day, we did a lot of stuff.
Once again, back in our days.
Walk up to you and lick your neck.
Yes.
Yeah, be trying to talk to you in your ear and do all the different little things. Or you see some people just start kissing random people in the club and doing things. You gotta really pay attention.
Like the cute dogs.
The cues.
It's like
So back in, let's say, early 2000s, Game Street looked totally different early 2000s.
Right.
So we clubbed on Game Street. It was a club called the Late Night Library, and across the street it was Onyx or whatever the name of the club was. But the Late Night Library was the spot.
Yeah.
That was the spot. But in these clubs, and I've been clubbing since I was like, in adult clubs since I was like 16. We used to sneak in. I had no idea why they let us in. But those are things that we would see. We would see just people randomly licking on each other, randomly kissing on each other, randomly.
I know.
I was scared.
And I've even gone
See
to
this?
the, if you go into the clubs,
this.
but look, if you go into the clubs in like bigger cities, we want you to understand, when you go to the clubs in bigger cities, you'll see a lot of things, especially if you go to like the LGBTQ clubs. You'll see them. They'll be having sex in the bathroom. They did it the other day. I went to 926. They was having sex in the stall, right next to into the stall. So you just be surprised, and they just meet random people, don't know nothing. There's no condom. There's no nothing. But then they go home and have sex in the club with somebody. But then guess what? They come home to you and have sex. So it's easily passed, and you don't know. You don't look at nothing. You're intoxicated for one. Two, you're in there having the best time of your life, and you just don't know. So that's why we always tell people, make sure you ask these questions. Be careful, because you'll be surprised at what people do.
Now, with all that being said, you'll be surprised how the majority of people that you're around are a lot more conservative than you think they are. We're in the South. We're in the Bible Belt. We're a lot more conservative than we think we are. Do we push sexual boundaries a little more than previous generations? Yeah, maybe. the 60s, you know, they set the bar. But we are a lot more conservative than people may believe. So the average person may not do some of the things that we may see on our phones, on some of the websites, or what we hear about. So just thinking about that as well. So when somebody, especially as future nurses, when you look at somebody or somebody's coming in and you have to treat this patient, think about client-centered counseling. So every time you meet somebody new, you have to tailor your session specifically for that person. So I may come in, let's say I come in, I have a mohawk, I have 3 tongue rings, I have 75 face tattoos, I got earrings everywhere, I got the gauges in my ear. I look different, I talk different. I'm saying things. I'm like, yeah, I had sex with 3 girls last week, unprotected, in the same day. I'm saying all these things. You get me in the room and I'm a totally different person. Mm-hmm. Oh yeah, well, I haven't had sex in 5 years. I'm this, I'm that. They transform. But what will allow that person to transform and become themselves is the environment that you create. How you engage with the person. Can you make them feel comfortable enough to talk to you? Strangers come up to us and tell us their sexual health. A lot of these people just had sex yesterday or that morning, and they want to get tested, and they come and telling us their sexual history. For us to get the truth out of them, we have to create an environment for them. So think about that as well. Be as human as possible. Be as empathetic and sympathetic as possible. It's not your job to solve these people's problems, but we're a resource to help them help themselves. Because we want to empower as many people as possible, because at the end of the day, safe sex is your job as an individual. I don't like this picture. I don't know why out of all the pictures, just like the one picture that I really hate the most, but it doesn't look nice, but just another example of how syphilis can display itself in the body. That's the first stage. Second stage is the skin rashes. They can last up to 2 to 6 weeks, average of 4 weeks. It will heal without treatment. Same thing with the first stage, the rash. The sore. So this is not acne in this person's face. These are syphilis rashes. Syphilis, once again, like you said, is the great imitator. It can imitate any other infections or diseases in the body. This person has it all on their back, all over the body. This person has it all over her body.
And mind you, people still have sex with these people. I just want you to understand.
Right.
Right, but
like
this right, the first one, but go to the second one, Joe. That doesn't look like acne.
Right.
And they're still having unprotected sex with people. That's on their back, but it's also on the front. It's everywhere. You can see it.
With this, though, you have to know what you're looking at. But we're going to get to that. The average person will not look at this and say that this is syphilis. They will say it's acne. And maybe proceed to whatever. Now, I'm not saying if somebody has acne in their face, you try to go up and diagnose it. I'm not saying that. But what I am saying is just another example of how syphilis can manifest itself and look in the body. You think it's one thing, it could be the next. That's why testing is important. Another thing is, just hygiene and all these different things here. If it doesn't look right, don't smell right, don't sound right, don't do it. Find your buffers. Mm-hmm. Whatever your individual buffers are, find your buffers to keep yourself safe. This is what we call palmar plantar. So palmar plantar is the classic signs of syphilis. It's within the second stage. We see this a lot, and this is palmar plantar that's kind of older and dried up, like the sores have dried up, but fresh palmar plantar, you see a lot of black lesions on the person's hands and on their feet. So a lot of times, let's say if we're doing a syphilis test on the person and the syphilis test come back reactive, well, we're going to look at your hands and we need you to take your shoes off so we can look at your feet. So we can try to determine what stage you're in.
Is this curable?
It's still curable. Syphilis at any stage is curable, but any damage done to the body won't be repaired.
So it does still have sores.
Right.
The sores will clear up, but they could have the spots like chicken pox, stuff like
rashes.
that. it could do that, but we can't affect it. But normally how you cure this is either you get almost like doxycycline for about 28 days, depending on the severity. Then we also give you, if you don't get the doxycycline, we give you 3 shots of bicillin, which is 2.4 million units in 1 shot. So sometimes we don't have the 2.4, so you get 1.2 in each cheek for 3 weeks.
Yeah.
So it just depends on
And
what
what
it is. Every week you come back and you get a 2.4.
And what does it feel like? What it's like toothpaste?
It's like toothpaste. It keeps it. It's in the refrigerator, and so it's in a syringe, and the needle's like about an 18 gauge, and so we have to put that into you. But it's cold, so it's like we gotta try to warm it up. But it's thick, milky, like toothpaste. So I can, when I squeeze like this and push it in, I actually feel the stuff going in between my fingers. So it's very thick and it's very painful, and it hurts.
You had a question?
Oh.
So just more examples of what syphilis can do in the second stage. Remember, syphilis, like any other bacteria, any other living organism, is trying to survive. And your body, it's its place. So
Also, when you get tested for syphilis and we treat you, you will always have a trace of syphilis in your body, no matter when it's gone.
Right.
So you always get a titer. The titers are normally like a 1 to 1, 1 to 2, 1 to 4. Anything normally goes a little higher depending on the number of your titer. We just have one with 2,058 or 1 to 2,058. So it's very high. So he could have ocular or neural syphilis. So it gets very complex once you do it. But once you test positive for syphilis, you will always test positive for syphilis.
Right.
It'll show a titer.
it just leave a syphilis was here sign
Right.
in your body, something like that. Just think about it like that.
To transmit it no more after they're cured.
Right.
Right.
After you get treated and stuff like that, you can't transmit it again, but you can get reinfected. And that's how we would know if you get reinfected, by your titer going up.
Right. But so, because of time, we're gonna speed up a bit. But this is another example of syphilis being a great imitator. Syphilis looking like genital warts, and this is the vagina going down to the anal area. So very, very, very uncomfortable, very painful. So that's the second stage. The late stage could cause paralysis, insanity, blindness, damage to knee joints, personality change, impotency, aneurysms, tumors on the skin and internal organs. So this is, when they talk about ulcerating gummer, they're talking about something getting to the flesh-eating stage. So basically, syphilis is in the flesh-eating stage where it's really just destroying the person's body. The person is in the third stage. They can still treat the bacteria, but the damage won't get repaired. Congenital syphilis passed from the mother to the child. So once again, prenatal treatment is important. That's why we preach healthy start. There's a perinatal and maternal program. A young lady, she teaches on this campus, Kira Adams, has a perinatal and maternal program that's free for mothers that you can get services for, along with Healthy Start. And Tallahassee has done a great job of putting resources in places. All people have to do is access the resources. Testing and treatment for syphilis, easily detected by a blood test, easily cured with antibiotics, and the damage done to the body won't be repaired. This is genital herpes. Herpes cannot be cured. So like I said, I'm gonna go a little faster so we can show you the ones I really want to show you. Herpes, it won't be cured. It can be treated. It's another example of what herpes can look like in the body. No matter your race, no matter anything, herpes can affect you. This is, it's affecting this vagina externally, this vagina internally. So, and once again, now remember I said red means stop. This vagina is not red, it's still bright pink. So it can still look as if everything is healthy, but because we have the Pap smear equipment, we can see the herpes on the person's cervix. Testing, protection. Two of your biggest things you're gonna need. Conversations. This is herpes on a person's finger. If I could take this picture out of here, crop it, and put it somewhere else and tell you that this person cut their finger, you wouldn't know the difference. If somebody was walking around outside with this on their face, the last thing you would say is, that's herpes on your face. That's the last thing you'll say. So what we're seeing is, a lot of times it doesn't look like what we may think it would look like. It could look normal, or it could be hideous, or it could be right somewhere in the middle. If not treated in adults, genital herpes may cause stress and pain. It's lethal to neonates. Babies do not survive. Can be detected by culture and lesion. You can spread herpes even if you're taking your medicine. Symptoms can be treated, but it won't be cured. The youngest person I've met so far that contracted herpes was a 15-year-old girl back, I was like 2-3 years into doing this. This is a 15-year-old girl messing with an older guy. She contracted herpes, and the question she had was,
Why are you looking at me?
the question she had was, who's going to marry me? Because she understood stigma at the age of 15. That was her question. Who's going to marry me? Because at the age of 15, she understood that if people know I have herpes, they might not want to deal with me. Now,
Wouldn't it always be like spreadable?
not necessarily. There are people who have healthy sex lives who do have herpes.
So what do you mean by it can still spread even if you're taking your medication?
Outbreaks. If you're having, especially during outbreaks.
So even if you take your medication during the outbreak, it can still spread?
Yes. Yes. Especially during outbreaks. But once again, there are people who have herpes, who have healthy sex lives, they have children and everything because for one, they got with their doctors, they got with their primary care physicians, and they came up with a safety plan. And so when we're having outbreaks, we're not having sex. In between outbreaks, we're taking the right precautions that we need to make sure that we're protecting ourselves when we are having sex, and so on and so on. So that doesn't have an HIV or herpes or anything. That doesn't mean your sex life is over. That just means you have to take extra precaution when you're having sex. These are genital warts. This is what genital warts can do to the body. This person on the left took the foreskin and got creative with it. You can see some of the warts on this person's penis here.
Now, do you know how we get rid of those?
Cut them off?
You either burn them off or you put TCA, which is an acid that goes on top of them, or they're surgically removed. But they can come back.
Right.
Warts and stuff come back with stress, things like that, just like herpes outbreaks. So you have to be very careful when you get these type of things. But they are able to be taken off. But what I said, whatever damage is done, so you might not be the same depending on, like especially like with the reef.
Right.
It's going to take off everything that's there.
See, it disfigured this vagina. And some of the issues is, right, it's covering her urethra. It looks like it's covering the vaginal opening, and it looks like it's covering her anus as well. So it may hinder elimination. This person had the warts removed from the inner part of the vagina, but you see it's bright red on the inside. Infection is present. This person is getting their cervix cultured. They're checking to see the level of antibodies in the system. This person has the warts on their tongue. The most beautiful person you've ever seen.
Joe.
And
Sorry, Sarah, quick question. When you said it has to like burn them off, are they awake for that?
Sometimes it just depends. Yeah, you'll go to like a dermatologist and he'll be able to burn them off and do things, or they'll use that little freeze spray to do things and have them fall off. So it just depends, but it depends on the severity of the warts and how bad it's going to be.
so when I see this picture, it's just another example of being mindful of how we interacting with people. I'm a guy. Men, we are socialized, especially in my day. We socialize if a woman want to give you some, you take it. That's what it was. That's just what it was. We had to learn control as we got older. We had to learn that just because somebody want to have sex with you don't mean you have to do it. But also, people make bad decisions when they're under influence of drugs and alcohol. People make bad decisions when they see the most beautiful person in their life. So just because somebody want to put their mouth on you, I mean you have to let them put their mouth on you, basically. This is perianal warts. This is a person who had genital warts in their anus and didn't necessarily get the treatment, and it got worse. So so this is granuloma inguinale. It's a aggressive form of chlamydia. It can't be cured, but it's very, very aggressive and it's flesh eating, and it ate the head of this penis off. It ate this vagina. It basically did what it needed to do, and the bacteria just dissolved the vagina over time. So think about the natural behavior. The person contracted chlamydia but didn't get treatment in enough time, and this is what happened. So this last one is lymphogranuloma venereum. It's another form of chlamydia, aggressive form of chlamydia. The difference between this and GI, that it makes the body part balloon up and then it disintegrates. So this penis is bigger than what it's supposed to be. It ballooned up and it started to disintegrate from the inside. So you got to be careful. And these forms of chlamydia are in Tallahassee as well and the surrounding areas. Yep. And the first place I learned about this was I read an article about a guy at a strip club in Atlanta who contracted it from the stripper in the strip club in Atlanta. So that's the first time I heard about it. No, he was sleeping with it. He had unprotected sex with her in the club and he got it. So this last one, this is a vagina.
Is that her lip?
Mm-hmm.
I think
I
so.
think that's what Katrina said. It's the lip.
Yeah, it's something. I thought I knew what it was, but I don't. It's something in there, but it's an example of what this particular STD can do to you. So that's why we still preach abstinence, safe sex, smart sex. Do you really know the person you having sex with? Do y'all really know y'all status? Are y'all trading information? Go get tested together and look at their status and let them look at your stuff. But remember, also, you got to have your healthcare professional hat on too. Mm-hmm. Taking this information, how can you use this information? How can you translate this information to the people that you serve? How is this information useful to you? Is it useful to you at all? So just things, not questions you need to answer right now, but things that you need to think of along the lines. Neighborhood Medical Center, that's who we are. If you need to get in contact with us, Dr. Dickey has our contact information. We do a lot of community work, a lot of testing on campus and things. If you see us, don't act like we strangers. Come say hey to us. Any questions you got, we can answer them. We appreciate you all's time. Mm-hmm.